We will be actually recording this information today, so for people who were unable to be with us. So let me tell you who's on this call so you have a little bit of context. Essentially, school leaders, the superintendents, heads of school, our principals from our public, private, independent, and parochial and non-public schools in Marin County. So just to sort of frame that for you to start. You've heard the term, I think, about how it is that from time to time we find ourselves sort of running towards something. I'm forgetting the term, of course, but anyway, you're getting ready to get something done, and so you go slow to go fast, or go fast to go slow. And at this point, everything to do with vaccination seems to be evolving, including as recently as last night, there was new guidance from the state to the public health officers. And so what I want you to know is that essentially what we're doing here in Marin County is getting ready. Because there will be a day when there'll be a strong supply of vaccines in Marin County. And we want to be sure that as soon as we get the call that says we're ready to go, that our schools are in fact poised to be able to lean in and access the vaccinations. There was a meeting today with the leaders and decision makers from throughout Marin County, representing Kaiser Permanente, Sutter, Marin Health, Public Health, the Marin Community Clinic. I was represented the schools in that meeting, and there was an absolute unequivocal commitment by that group to work together to make sure that we were as efficient as we could possibly be in ensuring that vaccines become available as soon as they can be available. So let me give you an overview. What we're going to do is we're going to hear an update from Lisa Santora, who was also in that meeting today to provide sort of a high level of what's happening related to vaccine supply and distribution within Marin County. And then we have on this call Michael McDowell, Superintendent of the Ross District, Brett Geithman, Superintendent of Larkspur District, Trina Mars, who's the Deputy County Superintendent, who are a subcommittee that have been working on how it is that we can be ready, i.e. what data do we need from our public, private, independent schools in order to get our staffs vaccinated. So we'll hear from them, and Michael and Brett and Trina, I do have the availability to bring up the list of that, so for you to talk through and for you all to know that the instructions are slightly different for the public schools than the private, independent, parochial schools, because for the public schools, we're on a single system except for Novato. And for those of you in the private, independent, parochial schools, where we're going to be providing you a template for you to actually access the information. This is going to be time sensitive. We're hoping that we're going to get responses sooner than later from all of you, including as early as tomorrow. So we'll try to answer any questions that you have. So with that, Dr. Santora, thank you very much. So Lisa, on this call, there's about close to 100 people representing our public schools, private, independent, parochial schools, and we want to get them ready so when the day comes, we can move forward.
So thank you everyone for being here, and thank you everyone for all of your partnership in supporting the safe reopening of schools. That first step for us was getting those school site specific protection plans implemented. We're moving forward with increasing access to testing, but what is most promising and brings us most hope is access to vaccination across the county of Marin. So we are moving forward with a countywide plan to optimize vaccine distribution so that any given day that Marin County receives vaccine as it's allocated, that we are distributing efficiently and effectively and safely as quick as possible, so we can optimize and get to that herd immunity level that will again build confidence for more people to return to school safely. That's one of our overarching goals, is the full return of in-person instruction for all students in Marin, and vaccine is one of the tools to get us there. So we are doing this in partnership with the partners that Mary Jane mentioned. We're going to be meeting this week. We're going to treat it like a fire. It's great to have a fire chief at the meetings. Just like any large scale incident fire, it requires an incident management approach, and we're going to be using all the resources. And I think for me, every day there's all these silver linings that just reinforce how great it is to be in Marin County, where one, we have these relationships that can execute these. Two, we think outside the box and can bring in partners like Fire, and they're ready, willing, and able to support us to optimize that. The first step of optimization happened today, where we, I called it building the Death Star, making our Marin Center a fully operational clinic. We went from 700 vaccines a day to today we vaccinated probably easily over 1,000, might be 1,300 people that we vaccinate today. So that vision is going to be multiplied. Not only do we need to build a bigger ship, which we started doing here, we need to build a fleet of ships. So our goal within the next 2 weeks is that we'll have a countywide plan for having our Superdome. That is the Marin Center. It's the most super place for us, for the community the size of Marin County, but then identifying other medium-sized spots across the county to make sure people have access to vaccines. So that's underway, and there'll be a site visit at Terralinda High School. So thank you, San Rafael City School District, for your continued partnership there, which will probably be our second medium-sized pod, M-Pod they're calling it. And then we are also will be looking at optimizing the distribution of vaccines to all healthcare providers, primary care providers in the county, as well as, there's one other bucket that was in my head. Oh, the canal, providing vaccine in the canal area, and then really focusing from an equity lens from the beginning, making sure that we are reaching out to some of the more vulnerable populations and communities of color, food service workers, construction workers, even some of your staff, honestly, who have been vulnerable and due to the nature of their work and having to work since the beginning of the pandemic, we want to make sure have access to that. So as everyone in this call knows, schools are a priority for us. We're going to be navigating some space. There's political pressures that you're already hearing about with the greater than 65 population. It's driven not by resource supply and not by science. It's being driven, I believe, in my opinion, politically at this point. So we still have there's higher expectations than ever in the community of the size of Marin, which has 27% of our population is over the age of 65 or over the age of 60. So we have a very big population. And so we are committed to navigating this space and prioritizing school and childcare workers as it's gonna be, I don't know, we'll navigate, we'll dance well, but it's going to be complex. But we really do have limited resources, and that's why maybe this is a time for me to pause, where there's been earlier conversations when there is scarce resources. How do we prioritize groups within the school community for vaccination? So I'll pause there.
Okay, great. So how about we go ahead and move to who wants to take? Michael, do you want to start with this?
Sure, I'd be happy to, Mary Jane.
Okay, and then we can, give a little background, and then we'll have, I think Ken Lippy's going to be able to bring up the document.
Yep, so one of the things, so good afternoon, everyone. One of the things that we've been doing in terms of knowing that there's limited supply and also making sure that we are prepared for vaccine distribution for all of our educators is, number one, to make sure that we could build a very simple roster that we could quickly submit so that we're ready for vaccine distribution. Number two is to create priority lists because of that demand. And so we actually have 4 tiers. And in this particular roster, we're asking everyone to make sure that they can identify people within those tiers. The first tier would be in-person. So anyone that's providing in-person instruction and services, which would include employees that are doing special day classes, any para educators one-on-one. It would include custodial, and it would include food service. So that would be the first tier. The second tier would be anyone who's providing any in-person instruction or in-person services. The third would be any distance learning. And then the fourth would be anyone that's going into schools that's providing any support, including some volunteers, trustees that you think are critical and that are coming into the school and into the school system. They would also be included on this particular list. One thing that for us that we think is really important is that schools self-govern. So you're really the ones that are identifying who should be in these particular priority groups. It's not us as a committee to try to identify whether people are doing this correctly, but really we're trying to be as honest as, we need to be honest. We need to say, this is the group that needs this is our priority group. And so with these limited supplies, they need to go in and receive this work. So you'll receive this particular roster. Please populate it using your best judgment. And then with that particular priority list, that's when Marin County Office of Public Health can say, these are the priority lists that can go, or the priority groups that can go, and then we can assign that for a particular school. So I'll pause there and see what I missed, Tarina and Brett.
I think you covered it, Michael. I think, we have a document we can review in a little bit that kind of spells out what Michael just explained, that could serve as a resource for schools. And so as Michael was saying, populating these specific data fields, but looking at it as a school site, not as a district. I mean, district, of course, but we need to have them identifiers by school site as well. So, but again, we'll have that document to show and review.
Mary Jane, would you like us to share that now?
Yeah, that would be great. And just as a caveat, the one other area is bus drivers. Dr. Santor and I spoke about that, and Lisa, they're on that first list as we talked about it. And that just as whatever list you're going to show, Tarina, will ultimately, just for if you're a private independent school, just know there's one for you that is framed ever so slightly differently. We'll be able to show that to you as well.
So just to walk you through, just to reiterate what Michael described, these are the priority categories. Priority 1, all food service workers, employees providing in-person instruction or services in the special day class, including teachers and paraprofessionals, one-to-one aides. Bus drivers, custodial staff working in person. That's the first priority. The second priority are all other employees who are working in person. The third priority are all other employees working remotely and or in providing distance learning. And the fourth priority include trustees and any other ancillary personnel that you may have working in person to support students and services, school services. We have a key definitions down here for special day class. For our private partners, this is specific to staff that are supporting students with disabilities as determined by the Individuals with Disabilities Education Act, otherwise known as IDEA, in an in-person classroom setting. So that's the really first tier. And then we have a definition of custodial. Those are custodials that are working in person, professional one-to-one, and faculty, staff, and administrators, any and all staff that have been approved on a personnel summary or independent contractor for a school or school district during the current year. We're also aware that there are many, not many, but there's a fair number of personnel that are supporting our students and our instruction that may not be employees, and that will be an additional add. So contracted employees providing in-person instruction and services would be included here. I'll pause there. There's a database, there's a data download system that's going out to everyone. Public schools will get one, private schools will get a separate one. We have different ways of pulling our data, and that will be going out this afternoon. These are the procedures and the data elements that we're asking for that will enable us to collect and sort this data. And I will stop there.
Okay, is there anything else that you all would want to add at this point? Michael?
So it looks like there's a little bit of a question in terms of office staff, administrators, things of that nature. And to us, we look at that as in that priority group 2. They're providing in-person instruction or services. So that would be the group. I think, again, the key for us is to go through this roster, do it to the best of your ability in terms of those priority groups, not to get too hung up on specifics, but to do it based on, we think this is the group that people need to go into. We want to fill this roster, and we're going to be as honest as possible to support the entire community. I think those are and I think if we lead that way, we're going to be just fine.
Yes, and I think just a reminder for everyone, our communities are talking to each other, right? And so it doesn't matter whether you're different public school district or public school. So I think it's important that, this is a guideline. I want to give an example that could could shift an office staff from what Michael just shared. In some cases, our office staff are the people that are actually proctoring or checking in people when they're doing their curative testing. By way of example, that person would be different than someone that's not interacting, right? So there could be situations, I think, Lisa, you would call them community-based health workers or whatever. So
Right,
there's a,
community health workers.
right. So there could be those, those situations as well. Okay, let's take a look at the questions before we move on. So can you help with the questions?
Sure.
You're muted. Yeah.
Yeah, sorry about that. Yes, I'm glad to go through these questions with you. There are a few comments. Marin City Health and Wellness Clinic might be a good hub in partnership with MSCD and Marin City. A couple other groups that have volunteered their sites. If you know someone who is eligible for their shot but doesn't have email access, what are the avenues they can go through to try to register for their vaccination?
Thanks, Lisa.
We're piloting today. We semi-piloted today, and we're fully piloting tomorrow a walk-up mechanism. We're piloting with our in-home service providers. There are many of them who are not technologically literate and have low English proficiency. So we're working to have health education on site and shoring that up. Once we, I don't even know the week, today is Wednesday. It may be as soon as Friday that there's a communication that goes out that shares walk-in instructions. The challenge for us is controlling the invitation to make sure that we have sufficient vaccine doses for walk-ups. So that's what we'll work on first. This hopefully by Friday we'll have a good walk-up system that is shored up, and then as early as Saturday we'll be sharing invitations potentially to specific groups. So I apologize in now that is not as shored up, but we have been equity focused since the beginning on this vaccine clinic. It just takes it takes some more time sometimes to make sure that the resources that individuals who have lower health literacy or English proficiency or technological literacy can access this system, but we're fully committed to that and are piloting this week. So more to follow. That's
Lisa,
long.
can we jump to our colleagues from Dominican and College of Marin are on this call. And first of all, thank you to both of you for offering up your sites as potential sites. And based on the conversation today, it could be very likely that you will be getting a call to actually be considered. So that's number one. So thank you for that. But can you just talk for a minute about where those two, Dominican University and College of Marin, are going to fall in this? Are we requesting them to do rosters at this time?
Not at this time. I think we need to shore up that process now. So I think just preparing everyone that they need proof of that when they do arrive on site, when they're not eligible by age but eligible by employment, that to work on what would be the proof of eligibility that you as an employer would be providing as school staff. So that would be what I would recommend.
So Lisa, you're saying when I went, I'm assigned to the Civic Center. When I get there, I understand that you are now you're not just letting people walk in and say something. Would I have to show a proof of employment? Okay, and then in addition, they would be on a list.
No, we're not using rosters.
Okay.
The rosters are more for your side to prepare to notify your staff at the level at the priority groups that you've identified.
Okay.
So we're not cross-checking rosters anymore. It's too big.
Okay, and that might be different in the Kaiser Permanente led hub for Kaiser members, right?
Yeah, and that's what we'll be meeting to hopefully over the course of the next week and a half to really figure out how we're going to work collaboratively with Kaiser, meeting the needs of their system, and then making sure that vaccine is available to all in Marin, regardless of their insurance status. So that's the space that we're navigating now.
Okay, Ken, back to the questions.
We have preschool staff who are not district employees, but are present on our school sites with students. Can we include them in the second priority?
Yes.
Okay. I see that special day instructors are tier 1. What about in-person teachers in mainstream classes? For example, a second grade teacher.
Go ahead, Michael.
2.
Tier 2. Okay. To be clear, we identify all employees in these groups, whether or not they want a vaccine or not. Do they decline when they get the notice to vaccinate?
That's been our thinking. We've done it as an opt-out, not an
Yeah,
opt-in.
it's an act, they have to active, so there's an active process. They'll get the instructions on how to go to a specific link and to register. So not all are, no one's required to do this. This is voluntary. And then we know we need to do more for those individuals that don't have the technology literacy or the English proficiency to make sure that they understand that they also have been invited and are welcome to vaccinate when they're up in line.
Okay, who covers contractors shared between districts? Our tech support person works at least 3 school districts, as an example.
We would recommend that everyone include them. They'll get sorted in they're only going to get 1 notice.
Would substitutes who are not employees fall into group 2? Do we add them to our list that we submit?
Yes.
If they're
Yes,
providing
group 2.
in-person instruction.
But in person, not just a list of subs that have worked in the districts. So people that have actually worked in person.
There's a few other questions about what employees would need to show in order to receive a vaccine. Would a pay stub be adequate?
Yes.
Yes.
And then remember, for some of your contractors, they won't have a pay stub, right? From you. And so Lisa, let's just say I work in the school, I'm a speech therapist, I've been working all year, but I'm under contract. I'm actually under a contract with the school districts because we couldn't find a speech therapist. So that person, we'll have to figure out how to handle.
There must be, we're having this, there must be either some documentation or that they are in a contract, or there's a letter from the school district with that person identified that they're under contract with the school for that.
Okay. Okay.
Do we have an idea when the vaccinations will begin? Are we still looking at the end of January, first half of February?
Yes, but this is the complication of the navigating with the healthcare systems, the greater than 6, there's 2 competing priorities, honestly. There's a younger, less vulnerable group of school staff where our priority is returning to school, but their actual risk is low for both poor outcomes and for exposure to COVID-19. And then there's the greater than 75 population that is at great risk for poor outcomes from, not necessarily for exposure, they should be staying at home, but for poor outcomes. So we were hoping to have some of those conversations today around policy, but that's still under development. So we do anticipate moving forward in 1B with it possibly as early a week from now. We still have to navigate policy decisions around when you have limited resources, how do we distribute that? And again, there's not clarity in some sense because there's allocations that go to Kaiser under a different distribution than that comes to the county. So we're talking, as the state often says on their phone calls, we're talking, but that's a policy decision that has to be finalized. So that's the challenge. It was shifting schools into tier 1, phase 1B was to stimulate the return to in-person instruction. It wasn't based on their risk of poor outcomes or on their risk of exposure. And so I think that's the needle we're trying to thread right now. So more to come, but you're definitely in tier 1 of phase 1B, but it's going to depend on vaccine supply and just some of the feasibility. So for the schools to be ready to jump in when the green light is given is the best thing we can do to do this.
Question from the College of Marin. Should we issue our faculty and nursing students a signed letter with current employment and registration verification?
Yes, and the nursing students shouldn't just be, so right now nursing students would qualify, but they should be in clinical rotations. So that's who this is intended for. So a letter to a nursing student that they're in clinical rotations is sufficient.
I think we touched on it a bit, but I think it might bear repeating based on numerous questions on this topic. What about after-school programs like the YMCA that operate on our school site? Would they be included in our priorities? Or preschools that also operate on a school site?
They're included in childcare. I consider that I use them as childcare. So I would consider the after-school programs as childcare programs. I think we would have to have conversations if there's secondary school after-school programs. It may be, we probably need to put a pin on that and discuss that. So it's clear to me that all the childcare, after-school childcare programs that are offered at the schools are childcare. That's how working parents use them. As the age that going into the secondary schools, we should have if the subgroup and I can have a conversation, that would be helpful.
And just a reminder, Aideen Gademore at the Resource Referral Center is providing the lead and relationship with public health related to all of our childcare providers, preschools as well. And in addition to our people that are taking care of other people's children in their own homes. So she'll be leading that side of the house, and they too are in a priority order with us in terms of 1B. And by the way, they've all been working since day one, March 16th or 17th.
So to be clear, teachers currently in person get vaccinated first, and those working remotely will follow at a later time, correct?
Yes. Correct. But it doesn't, but they stay in 1B. So remember, it's going to go all the way down the line before the system moves to the next group, right? So everybody is going to get their chance. And so I was saying to someone today, imagine there's a list of the people who've been designated 1. Well, you could be just one name from, right? Number 2, right? The number 2. So everyone's going to get their chance. It's just going to be in what priority order.
And this is really driven by the state and common sense. We want to vaccinate those who, again, it is not based on risk that the school and childcare is actually more riskier, especially the family-based childcare setting is probably the riskiest setting in this environment. But we want to make sure if you're on campus and you're providing on-site instruction, you have a higher risk of COVID-19 exposure, even though it's considered low. So we want to prioritize those groups, especially those groups that have been working. Our childcare providers have been working since March, many of them. And so we want to make sure we prioritize those groups that have been working as essential workers in the community since the beginning. That's critical for us.
What about crossing guards?
Good question. They're outside, so the risk is lower. The why transportation came up is because on a bus, it's an enclosed environment, so it's a priority. So I would defer back to the subgroup. I love when I don't have to make a decision.
Actually, in our Rethinking Schools this morning, we had this exact conversation and went to their outside. They're, you know what I mean? They're outside all the time outside. So ultimately, I think they need to be on the list, but we'd have to decide what tier that we would put them in. And also for many of our bus drivers are contract bus drivers. So we have our lead agency, San Rafael, and Dennis Petrie on the phone right now. So he'll be helping work with the contractors around being sure that the bus drivers get in as well. I want to describe for a minute what this is going to look like in terms of how it might happen. And Lisa, is there a chance this could happen this weekend? Maybe. Lisa,
I'm unmuting. I don't think this weekend. The nurse,
Okay.
Your phase 1A, your specialists are going to get in this weekend. We're working now to get them in. I don't think it's going to be this weekend. I'm going on site tomorrow at the Terra Linda High School with Kaiser. The earliest will probably be next week.
Okay, so let's just say it's next week. And so just to describe how this happens. So imagine everybody will have submitted their lists, right? They've checked their staff, they're accurate, they're submitted. The information you're going to get, we set up a special place for you to send that email, right? So this will be confidential, obviously, because it has, confidential information. So you're going to submit your list. Once we have the list, we're going to have a sense of the numbers, right? How many people are in 1A? And we'll be looking at that, like what that looks like. The schools have been essentially prioritized based by alphabetical order and the actual way that they are listed with the Department of Education. So I'll give this example before, not to pick on you, Branson, but Branson isn't under B, that their exact title is the Branson School based on the state database. And so we decided not to start messing with other than the state database, just so you know, that'll be caveated. But all of our schools will be listed in alphabetical order. So that's done, that right now that's being worked on. We'll send it out to make sure there's no issues there, but that's been set up. And then what we'll hear, Lisa's gonna call and she's gonna say, hey, there's a 1,000, let's pretend. Well, no, if she calls and says, there's 6,000, I just want you to know we're all in. And that will be the greatest thing, just for you to know. Wouldn't that be the greatest? So let's assume, first of all, the best intentions. There's plenty. We get to sign up and go to the different places, and within a short time, we're all in. But we'll assume that isn't the case, and that she says there's going to be 1,000 available, right? Well, we now know what our tiers look like. And we're going to make sure that we apply that fairly. And we're looking at applying it in chunks, if you will, of 25 people. And we start at the top, tier 1, right? 25, 25, 25, all the way down. You'll get a notice and you're going to notify your people, the first 25, to go ahead and go to the links and sign up, right? So something like that. And then if it was 1,000, we'll get to go back, right? And look through that again. So that's a way that we can affect everyone in the county. So imagine, we know everybody has custodians. So, everyone's going to be able to, everyone will have someone in tier 1. Those names are being requested when you look at this alphabetical order by last name, Michael. Alphabetical, yeah, by last name. So that will be the way that will play out, assuming there is not enough supply to be able to say, everybody sign up. The appointments are open. And so we never know though, because there can be, right, Lisa, a moment when, and the only way we're going to get into this right away is to be ready to go. So please note that this will be a priority, and I know you're all busy and you don't have time for this. And I totally understand that, but make time for this, because this is an emergency. This is an opportunity we're going to have, and the sooner that we get the list. But let's say you're a school that didn't supply the information, then we're going to be going to school, A, B, C. This one doesn't have it. We'll skip them and go to the next school, right? So just for you to know, and not that it wouldn't come back around, but people are going to want to make this a priority.
Yeah, I mean, honestly, it's just we're also going to be getting additional guidance from the state as soon as next week. And so the more prepared you are to get in your highest priority groups into a vaccine clinic, the more likely they will get vaccinated. The greater than 65 population in Marin is very big. And so there's 2 competing priorities. That's what we navigate every day. And that's going to be the more ready and launchable and feasible, the more likely at this point.
Right. And Lisa, the over 65 is about over 50,000, right? Is the
27% of 267,000. So
okay,
30.
so that's the number. And I did already do the scan on just the public schools. If that happened and there was a shift there, we have approximately 220 people total. So it's not as though we get some big number of our teachers, paras, etc. By looking at just that age issue.
Will Kaiser be identifying their patients for vaccinations and contacting them versus the schools?
No, well, Pfizer doesn't have a mechanism. They have some databases where people may have self-identified that they're a teacher in their health profile, but that's not going to be the mechanism. And again, the Kaiser as a healthcare system is incentivized or driven to vaccinate the 75 plus population, because that's the population that's going to be hospitalized. So that's why this coalition that we're working on is so critically important, where we see vaccine as a tool for the safe return of students. And we also know that the 75 plus population, if infected with COVID-19, would have the highest probability of a poor outcome. Not all of them have poor outcomes, but have the highest possibility of a poor outcome. So that's Kaiser is at the table. We know the majority of school, the majority of Marin County residents are Kaiser members. And Kaiser knows that the challenge ahead of them of vaccinating through the phases, their members benefits from having a coalition approach. So, but I don't anticipate Kaiser right now. Things could change, when we catch up a bit. Right now, we're doing direct outreach to school workers. But it is Kaiser that's in partnership at that Terra Linda High School to see as potentially a location for the vaccination of school staff and their Kaiser members. So it's just navigating priorities right now, balancing priorities and balancing operations.
Couple more
Also,
questions.
Sorry,
I'm sorry,
let
go
me
ahead,
just
Mary
say,
Jane.
one other thing for you all to know, during this meeting today, I made a commitment on our behalf that when it comes to the need for people to deal with the logistics around making sure that it isn't a staffing issue about being able to get these opportunities open to our school staff. So, and there could be things like making sure the lines are moving, people are social distancing, they have their PPE, how they're setting up the 15-minute wait period, etc. After the vaccination. And so please note that there will be, before we know it, an all call to actually ask, to say we need people to help staff. And as they've been talking about how they might set up the Civic Center, they might be doing not 1 8-hour shift a day, but 2 8-hour shifts or 3 8-hour shifts, right? So they're really talking about this is a priority in our community. It's an emergency. It's important that we get as many people tested as possible. And we will be part of that overall story to provide support, not just with sites, but also with actual staff that would be able to provide support. And that will be a necessary part, not just from our sector, but from all sectors.
To be clear, once we are notified that vaccines are available, schools will be notified at that time, and then they in turn notify staff in Tier 1 who then sign up. Do we have an indication of what the sign up process will look like?
If it depends on which, it still depends. If they're coming to our pod, it's going to be a link, and they'll get a link. They're going to put in their information. They'll receive information about the vaccine, and they'll schedule a time for the appointment themselves. We won't know the logistics about the Terra Linda site until tomorrow. There is just the Epic Kaiser side of it. We're trying to navigate that. We have some data requirements that work well with Kaiser members. But then there's other tools that are needed for non-Kaiser members. So if it's at the Marin Center, they'll receive a link and they'll schedule an appointment, and then we'll work with this team for walk-up access for people that don't have access to internet. But again, things are moving really fast.
There's another question about process. To be clear, priority 1 people across all schools in alpha order go first. Then priority 2 people across all schools in alpha order. Is that right?
Right.
Yes.
Okay.
But hold a thought that it won't be everyone from Tier 1 from the first school on the alphabet, which happens to be Adeline Kent School. Believe it or not, it's not called Kent Middle School at the state database. Adeline Kent School.
Someone had good planning a while ago, like in the phone.
Yeah, way to go. They knew. So that school
Used to have an A in the phone book.
I think it's number 1. And if that's number 1, it is not going to be all their number 1 people first. It's going to be a number of their people once we look at the data set, and then all the way down, so that we cross-cut all schools in the county.
Yeah.
Oh, we have Anthony Basic. Oh, Lord.
Ah.
I cannot believe it.
Once,
Unbelievable.
oops, sorry.
Unbelievable.
Awesome.
Once notified and people sign up, are they given a date and a place for the vaccination? If they do not sign up within a time period, does MCOE then move on to the next school?
It's not going to be that coordinated. We're going to need time to see. We're going to need to see time to see how they fill up or not, because again, remember, we could be inviting other groups. Right now the links are all open. So right now we're using it the Southwest comparison. Phase 1A people, once the links open, the clinics open to phase 1B, will still have access to this. So it's just if they get a reminder, if we pulse phase 1A and say, hey, there's still clinics open, some communication, they'll be there. And just to be aware that will happen. So there will be slots filled. Some of the conversations we're having, there could be conversations that we're having at, can we pilot the Terra Linda pot? I mean, that's.
Yes, this weekend. We're going to staff it. We can't wait.
Yeah. So we're just still in that development conceptualizing phase, and just know that you have a strong advocate in Mary Jane and a mom who is not thriving right now since both the return of in-person instruction and knowing that vaccine is a tool for that.
Mhm.
That kind of wraps it up.
One of our school districts-
Once you're in, you'll be notified of, once they're in, they'll be notified of the second dose. So they're in the system, they'll receive a notification. We're working on that now, and they might get, we're working that on the day they get their first vaccine, they might be scheduling their second appointment. So working on some of those logistics. So you don't have to worry about once you get them in, what happens with their second dose.
Mhm. I think most of you know today, we're making sure that we're connecting to make sure we have the right people to know. The data will be really important, right? So we want to make sure we want at least 2 contacts for each school to make sure that when this happens, that you get your email and you move the information forward right away. So we're working on the contacts right now to make sure we have the correct contacts for everyone. So that will be obviously important, that people will be checking their emails, etc.
Yeah.
But you're hearing anything we can do to get in here at the front end is going to make a big difference. And reminder, we only have, including our childcare partners, let's just say we've got about 9,000 to 10,000 people total. And some people are not ready to take the vaccination. They're just not. We see it in the healthcare field, whatever. So take off some percentage that might not be interested. I mean, really, if we could get ourselves, because we're going to be so organized, we don't actually need that many days. Lisa, we just need 8 days of 1,000 and our entire community. And back to the issue of getting kids back to school and all the things. So it's not like we need that much. Just so you know.
What I would recommend for the folks on this call is to go on the website and the CDC website, where there's information about getting ready for COVID-19 vaccination. It's in English and Spanish, sharing that with your teams, helping us with the outreach and education around the benefits of vaccination for your teams, if you could serve that role for us, socializing them to start checking their email daily. And saying, it's coming, but you need to check your email every day. If you're not normally checking this account, making sure that they check this account, because this is what we have on file, so that they are ready. Because once these clinics open, the privilege will go first. I mean, that's the reality. And the more you can have your teams ready to sign up, that's what's going to give them the edge that they need. We will have continued conversations with our community advisory board around access, and there will be a school liaison to that, because you also represent the communities at large, and the best way for us to connect to families and vulnerable families, so that when this becomes a general population vaccination, you are our best tool about early outreach and education with the Latinx community that really would benefit from this vaccine, but there may be more hesitancy about accessing this vaccine. And we want to make sure that those doors are open wide and the education and outreach is done in advance. So when the call is due, they're ready to receive that call and be part of the general vaccine clinic, but we will also look at strategies for having vaccine clinics specifically in the canal area and targeting specific areas, for example, in Novato, so we can make sure we have an equity-driven approach. In 2009, I was part of a H1N1 vaccine clinic in Los Angeles County. It was the first drive-through, the first day that the H1N1 vaccine was ready. There were 13 clinics open that first day in Los Angeles County. And I had the sad experience of taking vaccine from Compton and bringing it to Redondo Beach. If some of you know, the beach cities has a very similar demographic to Marin County, because only 13 residents in Compton showed up to receive that vaccine because they didn't trust the government. They didn't feel it was safe. And so this is where our schools have always been a partner in equity community-wide. And so maybe strategizing around when we do get to the general population, how can we continue to be partners in equity? Because affluent white Marin will get this vaccine, and we need to make sure we keep the doors open and wide for our neighbors who have more fear around the vaccine and concerns around the vaccine and need more time and more education to prepare for it. So I just want to plant the seed now of the role of schools in educating families around the importance of them getting vaccinated, especially in communities of color where there might be greater distrust in government.
Mhm. So just for everyone to know, the email that you're going to get in a minute actually provides the information about vaccinations, how, why they're important, et cetera, that Lisa just referenced. And we'll start sending it out in the bigger story, but those links are there, I think, Ken. And the other thing I think that we can be thinking about for our own staff who might have an email but probably don't check it, is how we're going to develop strategies within our own systems to help them sign up. Get in here, we're signing you up, let's go, right? So that's something that we can do ourselves to make sure that all of our staff people are able to sign up.
Yeah, so anyone on this phone call, go to our vaccine website. There's education materials available now. Go to CDC. I see you all as a choir for COVID-19 vaccination and ensuring we have an equity lens for COVID-19 vaccination. So don't go to Facebook and Daily Mail tonight. Go and hang out on the CDC website like I do. For a little bit. And then let us know what more information, when you review the information yourself as educators and as administrators, what is missing there that you think would help Marin, and let us provide that feedback to us so we can make sure it's there. The CDC has done its best. It'll get better with the new administration. There will be more staff, literally. There'll be more people working at the CDC, and there'll be more budget to the CDC. So that's a good thing. But that, as you know, when you're approved budget, it takes you time to bring that staff on. So go and review our website, review the CDC website. That's the music we have. That's the script we have right now. So as the choir, let us know if there's stuff missing, and if you see that there's more that's needed for us, for you to serve in that function of being the COVID-19 vaccine choir. My goal is to, this is being recorded, my goal is to be in Italy on my birthday, which is June 17th. And that requires us all working together to get this community vaccinated. I think we can do it together. And I think we need to have a racial equity lens from the beginning of this planning to ensure that your families, all families in Marin, know that this is what's going to get us to having a much more fun summer than last summer. I know we're planning about schools, but I'm already thinking about summer break. So I want everyone in school, in person, before summer break.
All right, okay, for you, we're gonna do that, Lisa. So just a reminder to everybody, so you're gonna get an email. You're gonna prioritize the list. It might be hurry up, and we don't yet know, when we're gonna be able to start those emails. But we promise you, if we're ready, we're going to be ready. And hold the thought, this weekend is there's a holiday on Monday. So we could actually get half of the educators done, Lisa, just this weekend, right? So unbelievable if we could do that. So that's
there's a Mythbusters information on our site. We're hearing all the myths that are happening in the community, and our website, there's Mythbusters too. I just saw on the chat. So hey, your homework today is to go visit our website, scroll through all the pages, provide some feedback. If they can provide feedback to Rapid Response through Melina, that would be awesome. And to hold that so we can make some fine adjustments based on your feedback. You are trusted leaders to me. And I want to be able to let you know that you have, we have our ear on how we can improve it to make sure it's accessible to your staff and to your families. Dr. Willis showed pictures of the polio vaccinations. Which school was it, Mary Jane?
I think it was Green. I think it was Adeline Kent, actually.
Yeah, that's so funny. How ironic. Do we think it was Adeline Kent in Green Bay?
Yes,
It
exactly.
was not a socially distanced vaccination event, but it was a pod event that our community came together, and we would love, this is a historic time for us to do this together again. And schools, as I've been saying, are the fabric of our community, and we see you as that, and we'll be partnering with you to get my self-centered goal of getting to Italy and having a good summer break. As after my children have been in school in full time for at least 3 months. My goal. So
Mary Jane,
Yes.
I didn't want you to sign off without saying that there are at least 24 very heartfelt thank you messages to you and the panelists, all of the panelists, for the hard work on getting this ready for our schools. And I just felt that deserved mention.
Oh, thanks. Well, thanks to look. This obviously it's a team effort, right? Thank you, Michael, Trina, Brett, for taking the lead on this particular piece. We're excited. We're going to be ready. And so to all of you, thank you. We have a lot to be proud of. We still have a long way to go, right? There's more to do. As Dr. Willis has said, Mary Jane, this is not a sprint. So we just have to, keep going. But I think that we can be very, very proud. And I can't wait. You guys watch your emails this weekend. I'm serious, Lisa. I can't wait. Okay, get your lists in though. All right, talk to everybody. Thank you so much. Bye-bye.